Good afternoon, sirs. Good afternoon. So I'm going to go into why we want to focus on tobacco a little bit. You know, I'm trained as a naturopathic doctor, and I thought I was going to have a long career delivering babies at home because that's what I started doing. And then I found myself being a single mom of 4 kids with a daughter who had severe asthma, so I had to get a job that had great insurance and was one of the original tobacco documents researchers. So when the tobacco company went into litigation, they were forced to give up their previously secret documents. And once my eyes got open and I started to see how they were specifically targeting our communities, I could not close my eyes. That was 15 years ago, and I'm still trying to get everyone to understand just where the industry is in terms of our tobacco disparities that we're dealing with today. So when we think about tobacco, we have to understand that tobacco is the #1 killer of African Americans. It takes a long time for us to die. Our quality of life is affected. But when we look at the numbers, we're talking about 47,300 African Americans die every year. And this doesn't even take into account the numbers who die from secondhand smoke. And if we look at the numbers that are killed by accidents or murder or AIDS, those numbers just do not compare. They're still important for our community, and because tobacco is a chronic disease, we tend to just focus on the acute issues, but we have to remember the role that tobacco plays. So, for a number of decades, the tobacco industry has disproportionately targeted their menthol cigarettes to our community. It is by design that so many of us are smoking, and those of us who are smoking, up to 83% of us are smoking menthol cigarettes. And menthol has been used by the industry, not just because it's a flavor, but because it plays a role in helping to make smoking much more easier. And this is a big thing for our youth. Okay, so it makes it very easy for people who have never smoked to start smoking. It keeps people who have been smoking addicted to the nicotine because it plays a role in how the nicotine is absorbed. And it also makes it very difficult for those of us who want to quit smoking. So African Americans are disproportionately burdened by tobacco, more so than any other group in the country. 67% of all of our health disparities are directly related to tobacco. So if we get rid of tobacco, we would release a whole lot of burden on our communities. And nicotine, and this is something that's very interesting that I found when I went into the tobacco documents, because the tobacco industry has been a part of our community. They've shown up at a lot of our events, but they've never shared with us what they know about nicotine in particular to us. Melanin is our skin color. We also have it in our hair. The tobacco industry has known since the late 50s that those tissues that contain melanin accumulate nicotine. And that is possibly one of the reasons why it's so difficult for us to stop smoking. Now, most of our kids don't start smoking until much later in life. We don't smoke as much as our white counterparts, but yet we have much higher rates of tobacco-related diseases and death. And also, I wanted to say that nicotine actually competes with our intrinsic feel-good hormones. You know, we are designed to be happy and so that we will continue perpetuating the species. We're much more likely to be attracted to one another when we're happy. We're intrinsically designed that way. But yet nicotine will compete with those intrinsic hormones that we automatically secrete. I also wanted to bring to your attention the graphs that are here is in a report that was recently produced by the Centers for Tobacco Control and Prevention. And I can't really manipulate it by showing you because I can't, but if you take a look, you'll see the graphs of cigarettes, and you see that really long cigarette? Well, that's the number of our children. I think it's like 47% of our children are exposed to secondhand smoke. And you see that in comparison with other groups. And if we have our children who are also low income and living in very severe poverty levels, they're exposed even more. So I wanted to briefly talk about the African Americanization of menthol, and this is going to bring us into the resolution. Those of you who were here this morning and had a chance to see Dr. Benjamin, you know that our sorority, which is the first time any major African American organization has taken a stand on tobacco. And this is huge. So the amount of work that has been going on in tobacco control has increased tremendously because of this resolution. So even though you might not be aware of it, it is making a huge difference across the country. I have heard stories from black women who are not members of our sorority who have said that they've been approached by their white colleagues saying, "Oh, are you a Delta?" And this was in Minnesota. So I mentioned already that 83% of African Americans smoke this menthol. Nearly 95% of our kids who are trying cigarettes are smoking menthol. And there was a report that was produced by the FDA's special committee that took a look at all the evidence on menthol, and they specifically had to take a look at how menthol has an impact on African American communities as well as other communities. And they concluded in their report, and I'll read this to you, that the removal of menthol cigarettes from the marketplace would benefit public health in the United States and prevent the death of 200,000 African Americans by the year 2050. And this is, the report came out of legislation that was signed by President Obama in 2009. This legislation, which was years in the work, was really designed to help our kids prevent the uptake of tobacco. However, one of the things that they did in this legislation was to restrict the use of flavors from being used in cigarettes. However, menthol was excluded. Oh. And the majority of flavored tobacco products are menthol. And so this got a huge outcry from those of us who were in tobacco control. And by the time that President Obama signed it, he actually signed an amended legislation which said that menthol would be the first piece of work that the FDA, the Food and Drug Administration, would do. And of course, this was back in 2009, it's 2015. The FDA has still not acted. Menthol is still available on the market. And so I just wanted to share the resolution. As somebody who had the information, I felt obligated to bring this to the attention of my sorority, helped to put together a resolution that was introduced through my chapter, which is Berkeley Bay Area Alumni out of the Far West. We submitted this resolution for consideration at our convention in Washington, D.C. back in 2013, and I just want to quote Soar Daly, who said, "Not a single person out of 40,000 in attendance said a word about it. No one objected." So we have this beautiful resolution, which was introduced, as I said, through my chapter and approved. You can go on to the next slide. And I understand that Sora Benjamin this morning shared with you that last year on March 5th, 2014, attending a press conference here in Washington, D.C. I was actually planning to come to that press conference, but my father had passed and I was at his memorial service the day before, so I had no idea that Sora Daly was going to be there, and I can't represent our sorority. I'm not in a position to do that. But as a past national president, Sora Daly can do that. And she stood up at this press conference and said, Delta Sigma Theta has a resolution, and we support the ban of menthol cigarettes. And it was an incredible, incredible experience for us. why I focus on tobacco. So why are we doing HBCUs and focusing on helping them to go tobacco-free? Well, out of 105 HBCUs, 32 of them have a comprehensive tobacco-free policy, and this is really a good thing. So we have a lot of work to do. Anything less than a comprehensive policy is just not acceptable, because it's just not going to work. We've been doing tobacco control for a number of years, and we know that in order to reduce exposure, we have to have comprehensive policies. And the thing that we're really working on is changing the norm. So many of us have grown up with tobacco. I lost my mother to tobacco. I lost my grandmother to tobacco. I'm watching my brother die. He just had a biopsy done a couple of weeks ago. Thank goodness it came back negative, but there's something going on with his lungs. So it's become part of our norm. And we're not here to point our fingers at smokers, because our beef is with the tobacco industry. They started targeting us in the 60s. It's all about the money. It has nothing to do with them caring about whether or not our kids get supported or whether they get educated. It has nothing to do with that. It's all about the money. So, looking at the next slide, you can go on to the next slide. So I wanted to just quickly show, these are all the schools that have a comprehensive tobacco-free policy. So if you have a tie to an HBCU that is not on this list, we need your help. And it is important that we do this because it's happening on white campuses. They're going tobacco-free. But if we don't do this work, it's just not going to happen. And we have to change the norm so that the generation that's coming up behind our kids who are currently enrolled will not be pulled into this horrible lifestyle that can be years long. Okay, next slide. So we know that it's important because of our kids. African American students who are attending HBCUs very often come from communities of great need, and so they're the ones that are likely to be exposed to tobacco. And I've also been told that at a number of HBCUs, no one's really smoking. And that's okay. Still have a policy, because a lot of our HBCUs are right smack in the middle of communities where the smoking rate is high. And we do have a huge influence on what goes on in the surrounding areas. Okay, I can't see the next slide. I think that's it. So, just to reiterate what Whitney from Legacy said, Legacy has a pilot phase where they are providing funding to 5 schools. 5 schools are Fisk University, Livingstone College, Shaw University, Shorter College, and Talladega College. And this is a pilot program. They'll be given $3,000 to release some of the burden of doing the work. And hopefully, by engaging them, this will sort of like speed up the policy making happening at other HBCU colleges. And so we do have plans for a full phase. Later in the spring, Legacy will be recruiting and providing up to $5,000 funding to HBCUs across the country to support their efforts to advocate for, adopt, and implement a comprehensive 100% smoke-free or tobacco-free college policy. So with that, I will leave you all. There's contact information. Denise is sitting in the back. Thanks, Denise, for helping with the slides. So I thank you so much, and I honor all of you and the work that you're doing, and I'm so proud to be standing here next to our national president and all of our past national presidents and all the leaders in the room. So I'm happy to be here. Thank you.